If we don't take ownership of our health, if we don't take a true understanding of what's happening and where we're going, this is going to continue to manifest into something that will eventually extinct us. The food that we're eating is making us sick. The food that we're eating is getting us into chronic illness conditions earlier and faster. The food that we're eating is getting us into the doctor's offices faster. They're looking at how can we make food cheaper and more addictive, because if it's cheaper, they'll buy more. If they're addicted, they'll buy more. Thus, if they buy more, we'll make more. That's the cycle that we're in. This has become so much of a business. We are just literally in this system. Hey everybody, welcome back to The Odin Show. I'm your host, Justin Rothling-Schofer, and if it's your first time here, welcome. I'm super excited to have you and really looking forward to what you're going to dive into today. For all the past listeners who have been leaning in and have listened to this show for a long time, today's going to be a little bit unique. And I'm going to call on each and every one of you to put this episode into the hands of at least 5 people, because I will tell you, the normal marketing streams, the normal way in which this is going to reach people, it will not reach people. This episode is going to be subdued. It's going to be suppressed. It is going to be buried in and amongst the copious amounts of content that's out there, simply because of the richness and the calling out of the food industry that is going to happen in the next 45 minutes. This has been something that's been so close to my heart for a long time. And a lot of people will call it conspiracy theory. A lot of people will call it paranoia. I call it being able to connect the dots. And the funny thing is not only have I been able to connect the dots from my own childhood, not only have I been able to connect the dots from my education, but I've been able to connect the dots through all of these different papers and what you can find online, what you can find and you can research on your own in about 10 seconds. Everything I'm about to say today, you can validate on the internet. You can validate through your own research, through your own investigations. But why haven't we ever called it out? And I think this is the scary thing, because it's no surprise as to where we're at as a society, where we're at as a culture and as a country, in America specifically, but North America overall. And when you actually start to look at a lot of this, when you start to get really in depth and you start to get really clear, the scales get pulled back from your eyes. And what I'm about to say today, this is not just a food conversation. This is not just a health conversation. This is just not a nutrition conversation. It goes so much deeper than that. The reason I think it feels so dark in our world today and why there's this oppression is because this is a spiritual battle. I'm writing about it in a book that I'm coming out with called Holy Health. And I say, just like way back when in ancient times, there was fighting and wars fought over different spiritual doctrine and ideology. Today, the war is at the temple, and the temple is our bodies. And so the more that we dive into this, the harder we see, the more we pull back the curtain like I'm going to do today, the more you can start to realize that this is a spiritual war. This is something that is going on that is so much deeper. It has to do with the soil, has to do with the creation, has to do with our bodies and being able to create life, manifest life. There's only one battle that's ever being fought, and it's light and darkness, life and death. And we are literally in a battle for this. And the question is are we going to continue to keep our heads in the sand and be okay with the status quo? Or are we going to take a stand, start to put the dots together and say, man, why haven't we called this out before? Why haven't we said anything before? Why have we just been going along with our eyes closed, thinking that we're actually doing something that's healthy? And today, I hope it opens that up for you, because I talk a lot about this in my book, The Power of Ownership. If you have not read The Power of Ownership, I suggest you go to Amazon right now and purchase a copy. Because in The Power of Ownership, the title, Power of Ownership, Redeem Your Health, Live Life by Design, and Break the Relentless Pursuit of Normal. What I talk about is really diving into, again, calling some of this stuff out, but then giving strategies as to how do we move forward from this? How do we change the things that are actually considered normal in our day-to-day lives so that we can actually realize something new? Because here's the thing. Here's what I want us to actually start to realize. And here's what I want us to actually start to know. I want to go back to just some simple stats. Okay? Simple stats. I've got a lot of these pulled up here. 77% of people experience stress that affects their physical health in today's world. Someone dies every 33 seconds from cardiovascular disease, while someone else has a heart attack every 40 seconds. Heart disease is the leading cause of death for men and women, increasing at a rate of 50% over the past 30 years. 2/3 of adults are overweight or obese. That's meaning 71% of American men and women are obese or overweight. And 1/3 of them, 36%, are obese. At this rate, by 2030, estimates predict that roughly half of all men and women will be obese. Half. 50% of the people who live in America, increasing at a rate as 170% over the last 30 years. 60% of adults in the US have some type of chronic illness. 40% have 2 or more. What are chronic illnesses? Diabetes, heart disease, cancers, lung disease, strokes, Alzheimer's, or otherwise known as type 3 diabetes. You can fact check that as well. Chronic kidney disease. They're all linked to lifestyle factors. More than 37 million US adults have diabetes, which is a 120% increase over the last 30 years, and 1 in 5 of them don't know they have it. Metabolic syndrome is skyrocketing, not only in our youth, not only in adults, but in our youth. When you look at this, 50% of kids are obese or overweight now. 50% of kids, 18% of teens have fatty liver disease. 30% of teens have diabetes. That was only 1% in the 1950s. When you start to look at all of these things coming together, you start to say, well, how did we get here? I'm going to keep going because I think we need to know this. Type 2 diabetes are rising at an alarming rate, and the inability to process insulin is the fuel that increases type 3 diabetes, or otherwise known as Alzheimer's disease. 5.8 million people suffers from Alzheimer's disease that was started by a metabolic syndrome not being able to regulate blood glucose. And that number doubles every 5 years beyond the age of 65 and is expected to triple to 60 million people by the year 2060. I mean, now we dive over here into, we go back to kids. Autism. Autism today, kids are experiencing autism 1 in 36. In California, it's 1 in 22. Yet back in the year 2000, that's only 24 years ago. In the year 2000, it was 1 in 1,500. And you can't tell me that you're screening any heavier because the screening has not changed. When we start to look at some of these other numbers, and guys, this is real. This is what we experience every single day. When we start to look at life expectancy in the United States, the life expectancy for men and women has dropped considerably over the last 8 years and consistently. So much so that the average lifespan of a male in our country is now 73.8, and the average lifespan of a female is 78.1. You start to look at the difference between health span and lifespan. If lifespan scares you, health span is how many quality years of health do you have left? Even though you're living as a male as an average to 73.8 and as a female to 78.1, your health span as a male, you'll start losing that at 59.8. And as a female at 62.3. This is the situation we're in. And I'm not sitting here saying that it's our fault. What I'm going to call out and what I'm going to start to show you is that we're living in a rigged system. And if we don't take ownership of our health, if we don't take a true understanding of what's happening and where we're going, this is going to continue to manifest into something that will eventually extinct us. Which is why I'm telling you, it is a deeper spiritual experience. It is a deeper spiritual problem that we have to actually start to take a stand for and overcome. Because I want to take a look here. This is not me coming down on anybody, but rather a calling out of what's actually happening, realizing that we are on a big pharma treadmill from the moment that we come into this world. The moment our children are born, the moment that you and I were born, we were put on the pharma treadmill. And we've been led to continually believe that this is just the way it is, that this is just how it is. But what's actually occurring is that we are having continual metabolic dysfunction and cellular health decay start from the first day that we come from our mom's womb. The closest that we ever get to God, the moment we come into world, is the moment that we actually start falling away. And I want to call out some of these things because I couldn't believe this either. But when you look into the history of vaccinations, and I just want to just start to call this out, because as I've started to get closer into the parenting age and starting to really look at like children, I've started to ask some of these questions. Right when a baby enters in to this world, the very first thing that's happening is they're getting an erythromycin ointment put over their eyes, and then they're given a Hep B vaccination. The crazy thing is, do you know what is in each one of these? The two main ingredients are formaldehyde and aluminum. Not to mention that the way in which either one of these things are actually helping for Hep B or chlamydia, both of these are either A, transmitted through sexually transmitted diseases, or B, through some form of syringe injection that gets contaminated. Well, here's the funny thing. I don't think that child's going to have to worry about sexually transmitted diseases as long as the mother was, again, pre-tested, and the majority of those moms are going to be okay, but everybody's getting it. And so here's the crazy thing is, with all of these vaccines, with everything that we've been given, the biggest thing that these companies are doing is they go and they get massive funding. They get massive funding for the research that they're doing. And as they get massive funding for the research they're doing, how do they ultimately pay back for the funding that was ultimately given? They get it on the vaccine schedule. Because if it's on a vaccine schedule, then that means that everybody's going to be held accountable to getting those into them, which is going to be a massive money maker, because you want the drug used when you make the investment in order to do it. And guess who is funding all the research? Guess who's funding the schedules? Guess who's funding all of these things? Big Pharma. Big Pharma. They're funding the studies. They're paying the tech companies. They're ultimately buying off the academic institutions, because we as Americans have been taught just to follow who says the right thing. Who at Harvard, who at Stanford, who at Cornell, who at all of these, who at the Mayo Clinic, who at all of these highly like just these high standard institutions that we think are gold standard, that we think have our best interest in mind, have actually been bought off. Now, I'm not sitting here saying that all of there's a group in the back room that is conspiring to make America sick and to keep people down and in a negative state. They've actually believed that they're actually doing something good, something that's helping us, something that's getting us in a better direction. They're thinking, oh, you know what? We're going to prevent a lot of these illnesses down the road. Oh, you know what? We're actually making food cheaper and more affordable. You know what? We're making the livelihoods of people more accessible. But that's a lie that they continue to keep believing to justify the crazy cycle that we're actually on. And the sad part about this is that people are getting rich. People are getting wealthy off the continual metabolic decay of our health. Because if we took a step back, and I want to go back to like that 3-minute, 4-minute segment that I started reading about the current state of health in our country, you'd think that if what we were doing was working, if what we were doing was actually making a positive impact, with all the money we were spending, with all the funding we were getting, with all the organizations that exist, that we'd actually start seeing a decrease in a lot of these illnesses, a decrease in obesity, a decrease in diabetes, a decrease in a lot of these sicknesses. But in actuality, it's the complete opposite. The complete opposite. This year alone, we're going to hit 2 million people being diagnosed. 2 million being diagnosed with new forms of cancer. 2 million. And you come back to all of these diseases. All of these diseases have to do with some type of metabolic and cellular dysfunction. And until we understand our bodies, until we understand what we're putting them under every single day, until we understand what we're eating every single day, until we understand what we're being exposed to every single day, we will continue to keep seeing the norm happen. I reflect back on my own childhood, and I go back to, again, I was that child that got all the vaccines. I was the guy that my parents and like everybody else just followed the rules. And from a very young kid, very young boy, had nothing but ear infections, was on antibiotics seemingly every few months. There was a new antibiotic going through my body. I was the kid that had ADD, was bouncing off the wall, couldn't focus, couldn't keep me at the table. Yes, I was super athletic, and thank God that I was being able to play sports, but I was the guy that was couldn't focus in school, couldn't understand certain things, was overweight and eating all these different types of processed foods. Like this was just normal. But all of a sudden, and I say all of a sudden, and thank God, looking back on it, it was a really hard time of my life, but thank God that I went through this anorexic time, because I became obsessed with what I put in my body. I became obsessed with the food. I became obsessed with the quantities. And yes, was I underfueling? 100%. Yes, was I hurting myself physically because of how I was operating? Yes, 100%. But thank God I went through that, because even as I went through that, I had never felt more mentally clear. I had never felt like I could focus better. I could never felt like I had like these epiphanies throughout this, because I was eating whole foods. I was going back to eating nothing that had any type of toxins, any types of sugars, any types of these things. And this is the thing that started to create some real change in me, because when I went and got then my undergraduate degrees and master's degree, did a lot of my postgraduate work, I didn't take any more classes than anybody else. I didn't take any other studies. I didn't go and read any other books. I wasn't exposed to anything different than any of my other peers that went into dietetics, that went into strength and conditioning, that went on to medical school. I didn't take anything differently. But why does my thought process differ? This is again why I say it's a spiritual thing, because I just have a deep conviction knowing that what I was learning, what I was going through did not make sense, because I had experienced something so different. And this is what I want us to wake up to today, because as I've put a lot of this together, we have to realize what actually happened. What actually happened. And so if we look back on this, back in the 1980s and 90s, there was two big tobacco and cigarette companies, Philip Morris and R.J. Reynolds. And what had happened was in the 80s and 90s, obviously we were coming out with a lot of warnings and on the labels that, hey, smoking and chewing tobacco is highly addictive. It's bad for your health. And they needed to figure out what they were going to be able to do to be able to stay in business, to be able to continue to make money, to continue to be able to move. And so lo and behold, what did these companies do? Philip Morris and R.J. Reynolds went out and bought up all the food companies. And as they bought up all the food companies, what they were able to do was they were able to get the lobbyists, the food activists, all of these people on their side. And over the course of this, I don't know if you remember, especially in the 90s and early 2000s, the food pyramid came out. Well, that's when we saw the big diet shift in America. And there was billions of dollars given to institutions and experts to ultimately say, yes, you know what? We need to be eating a lot more of these sugary and processed foods as the base of the pyramid. Because guess who owns those foods? Guess who owns those companies? You named it, Philip Morris and R.J. Reynolds. So what happened was they actually went away from making tobacco and cigarettes addictive to now making food addictive. And as you start to see this and your eyes are open up, you're like, man, this is criminal. How can this actually happen? Well, because money and power make the world go around. And so as we continue to sit into this, as we continue to keep going, guess what also happened during that time? Sugars and seed oils. Sugars and seed oils ended up becoming the top end calorical intake that we take in as Americans today. But guess who started the production of these artificial seed oils? J.D. Rockefeller. What was J.D. Rockefeller? Well, J.D. Rockefeller was the biggest manufacturer and maker of oil. That's where he made all of his fortune. Well, what he ended up doing was he realized that he could actually break down a lot of the byproducts from oil into some form of cheap additive that could be made into rapeseed oil, cottonseed oil, sunflower oil, safflower oil. and ultimately be put into food that would preserve it, make it taste better, and make money off of it. So Philip Morris, RJ Reynolds, and now J.D. Rockefeller are all coming over to be able to make sure that they could fund what they were trying to do in a bigger way so that ultimately they could have a say in how our economy functioned, in how we were exposed to new types of food. And again, I'm not saying that the doctors today and that all these people today are sitting in a room going, hey, how can we kill the American people? But rather, they're not looking out for your health whatsoever. They're looking at how can we make food cheaper and more addictive, because if it's cheaper, they'll buy more. If they're addicted, they'll buy more. Thus, if they buy more, we'll make more. That's the cycle that we're in. This has become so much of a business. We are just literally in this system and this setting, because the way that we have been seen, every single American, every single person is simply seen as a dollar sign. What happens is who's more valuable? If chronic illness is actually really valuable, who's more valuable? The person that starts to get sick and starts to get on antibiotics as a 5-year-old, or somebody who starts to live really healthy and not get on antibiotics or need any type of medical care until they're 60? Of course, the 5-year-old. And you start to see this. Like there's protocols and there's things that are being called out now for 5 and 6 and 7-year-olds to be put on Ozempic. That's the first thing that they're looking for, that they're calling for to eliminate childhood obesity. Like, listen to this. Listen, and I know I'm getting ahead of myself here in a little bit, but like I want to be able to show you this. Like this is where it gets scary. A small number of companies control the majority of the world's food and beverage brands. Nestle, Pepsi Cola, Coca-Cola, Unilever, Danone, Mondelez International, General Mills, Kellogg's, Mars, and Associated British Food. So when you look at the brands that Nestle owns, things like Gerber, things like Perrier, Kit Kat, Haagen-Dazs, PepsiCo own brands like Cheetos, Quaker, Tropicana, Pepsi. Nestle, by the way, Gerber baby food, one of the biggest creators of baby food. Wait till we get into this. Scary. Coca-Cola owns brands like Sprite, Powerade, Fanta, Dasani. Unilever owns brands like Hellmann's, Lipton's, Ben & Jerry's. Danone, Activia, Oikos, General Mills, Kellogg's, obviously all the breakfast foods. So now we start to look at this, and I started to ask certain questions. And the biggest thing I asked was, does Pepsi sponsor health organizations? The answer was yes. PepsiCo has sponsored a number of health organizations, and they're also tied deeply into the lobbyist organizations against public health measures that would reduce soda consumption. Pepsi also sponsors 14% of the 95 national health organizations. These organizations included medical institutions, public health groups that fight to work obesity. Do you think that Pepsi would be for taking a lot of these products out of the use for these different people? Or do you think that they would actually be shown to, hey, Diet Pepsi is great, Diet Coke's great, diet drinks are great. Hey, we can actually get these in and have them be a quality sugar source for people. During the same period, PepsiCo lobbied against 29 public health bills aimed to improve nutrition and reduce soda consumption. This is absolutely criminal. It would be like all of a sudden if P. Diddy started funding the anti-child trafficking. Like it's a complete contradiction. And all of a sudden, if you're starting to do that, do you think that they're not going to withhold the actual truth in what you're trying to do? Let's move on to the next one. General Mills. General Mills has always been involved in the health industry in a number of ways. In 1983, General Mills partnered with the Wilder Foundation to create AltCare, a healthcare organization. They also engage in public policy discussions related to health claims, nutrition, labeling, and other health resources. They've also they've also made sure that they had people who were on executive groups in General Mills on the boards of guideline creation at the Diabetes Association and in DC. Things like Cheerios, Trix, Lucky Charms, Count Chocula, Betty Crocker, Pillsbury, Annie's, Nature Valley, and Haagen-Dazs, all brands under the General Mills platform. And why do you think that a lot of these brands are actually all in our kids' schools and all easily accessible? Now let's go over to Kellogg's. Kellogg's created the Kellogg's brothers, John and Harvey and Will, originally created the Kellogg Company to produce flaked cereals as a health food for people with poor digestion. What they thought about was that if something could fall apart easily, the body would not have to digest it, thus making it all sugary cereal so that when water hits it or a liquid hits it, it literally dissolves into a mucky paste. That was the thought process. This was the thought process. And so when we think about this, Kellogg's hosts an annual conference where professionals, academics, alumni, and students discuss healthcare industry issues. And in 2024, it was held at Northwestern's University campus, which it is also the number one donor for the Northwestern Nutritional School. And it also has a big hand in Tufts University Nutrition and Dietetics program, one of the most glorified nutrition and dietetics program in the United States, which sets a lot of guidelines and principles for the Diabetes Association, the U.S. nutritional guidelines, etc. This also, healthcare at Kellogg Pathway. This pathway at Kellogg offers a full-time MBA program that integrates managerial disciplines with exposure to the healthcare sector. Students can hone their skills through experiential or field course, which means that once they go through this, they then get put into seats like in the government, they get put in seats on lobbying organizations, and they get put in seats for different executive companies that are in charge of guidelines and mandates. Do you think that they would go against the person or the company that put them there? Of course not. Then we started looking at this. How many studies in health and nutrition have been funded by the government? More than 35% of all U.S. medical and health-related R&D studies have been funded by the NIH, so National Institution of Health. $97 billion has been put aside for research, $28 billion for clinical trials and related activities, and $9 billion for biomechanical workforce training. You think about this amount of money, and you start to shake your head and go, this whole thing is rigged. There's no way we can get out of it. Because then I ask the question, do any of the food companies hold board seats in the government? And you start to look at this. Yes, members of the U.S. government panel that helps develop nutritional guidelines have ties to food companies and other corporate organizations. Biggest thing, the Dietary Guidelines Advisory Committee. A report by the Transparency Group in the U.S., Right to Know, found that nearly half the members of the DGAC, which is the Dietary Guidelines Advisory Committee, have ties to food and pharmaceutical companies. Some of the industry actors with the most conflicts of interest include Nestle, Coca-Cola, General Mills, and Danone. I'm just going to pause there. Like if what I have said thus far hasn't shocked you and you're not just frankly a little bit pissed off, then I need you to re-listen to this. Because by now you should start to see what I've seen for so long. By now you should start to see why I'm on such a mission and creating Own It to be able to make sure that, hey, we can help guide you on looking at, hey, what is the habits and behaviors that you've been doing so far that you've had no idea about? How have they actually impacted you at the cellular level so we can see the deficiencies that exist? How is it that your body's communicating, saying, hey, I need some help from HRV and sleep quality? And then 3, how can we actually hold you accountable and create new processes, new plans, new structures, new habits in your life so that you can overcome these things? Because guess what? Your bodies are spiritual beings. They are resilient and they have been built to heal themselves when they don't have poison going in and day out because the fuel that we're putting inside is actually corrupt because we're living in a corrupt system. You come back to this, guys, like the lobbying, food companies and other industries with a stake in food policy and regulation spend millions of dollars on federal lobbying every single year. Some of the lobbyists are former employees of the agencies that regulate the industry. The U.S. has several agencies that are responsible for ensuring food safety, including the USDA, otherwise known as the FDA, Food Safety Inspection, and Centers for Disease and Control and Prevention. 80% of those people have people on their board, on their executive teams that have direct ties to those companies that are producing the crappy food, the poisonous things that we put into our body. Like it is incredible to see how this all plays together, how this all flows through. And so then you start to ask yourself, okay, what are the biggest nutrition lobbyist groups? The Academy of Nutrition and Dietetics, the world's largest food and nutrition, the world's largest organization of food and nutritional professionals. However, a peer-reviewed study found that the Academy has financial ties to the world's largest processed food companies. You don't think that they're going to be sitting there lobbying for their products to actually get seen, to actually move into some of these. And we go back to this whole thing. We've seen this evolution, right? So we've seen the corruption. And back in 1909, there was something called the Flexner Report. And the Flexner Report was something that J.D. Rockefeller signed, saying that anything holistic is pseudoscience and that we as individuals, we as human beings, are simply machines that are made up of multiple parts that can simply be replaced when something breaks. And that report, that bill from 1909 has literally shaped our medical system and the belief system of where we're going, because we've continued to be able to just keep people's heads in the sand. So something over 100 years ago has continued to shape how we operate today. And this is the crazy thing, because the food that we're eating is making us sick. The food that we're eating is getting us into chronic illness conditions earlier and faster. The food that we're eating is getting us into the doctor's offices faster. And when you go and you listen to people like Callie and Casey Means, or you go and listen to people like Will Cole, or you listen to people like Jason Karp, these people are continually speaking of the same language. They're talking about the corruption of the food industry. They're talking about the doctors. The doctors in our country, they have to report on MIPs. Basically, they're merit-based accountability measures. And what they're measured on success-wise, they think it's success not based off of if somebody gets well, not based off of they get off their diabetes medication, they get off their blood pressure medication, they get off the metformin, they get off all these other things. No, they are judged on success with the patient population on long-term medication adherence. How many prescriptions are they writing, and what's the frequency in which their patients are coming back? That's what they get judged on. That's the level of success. And so when you start to see this, their time, their energy, and their resource incentive is not based around the outcome of the patient or the client or you or I. It's based off of the incentives that the drug and pharmaceutical companies are giving them. And now here's the thing that I want us to actually step back to and start to realize, because we can be talking about this and people are starting to, I think, be aware of like what Big Pharma is all about, but I don't think people actually knew how insidious it is and incestuous it is inside the groups that are actually creating our food. And people are going to say, well, Justin, what can we actually eat? And we're going to talk about that in a second, of how do we actually get better food and how do we go about it. But I want to take a step further and into an area that I've been very bullish on and I'm very contrarian about, is peptide and hormone therapies. Because here's the biggest thing, and something that I think a lot of people fail to understand, and something that a lot of people just simply don't want to question or ask about. But if we go into it and we actually step in and start to ask, hey, who owns, it's like, just type this in. Just type this in. And I'm going to do it right now. Literally. Who owns the peptide companies? And when we start to sit in here, we start to go through the biggest owner of the peptide companies is called Big Pharma, acquired by Astrog, a leading pan-European private equity firm, in 2022. And you start to look at this. Other companies with peptides include Creative Peptides, Helix Biomedics, Biomer Technology, Peptide Technologies, Rhythm Pharma, and Topus Therapeutics, Biolingus. All of these, when you go and you look at what they are, they're all pharma companies. So when you actually come in and you start asking yourself, who owns the hormone replacement companies? Aspen Pharmacare, a South African drug banker, Pfizer, AbbVie, Millen, Teva Pharmaceuticals. The HRT market is expected to grow from $21.8 billion in 2022 to $40 billion in 2032. We have to stop asking ourselves, how do we solve the problem of having low testosterone or having these erectile dysfunctions or having hormone irregulations in both men and women? We have to stop asking the question as to what do we give ourselves, but we have to ask our question as why do we have to keep going and doing it? because it's not about getting HRT or hormone therapies or peptide therapies. That is not the answer. But yet we see more and more and more and more people popping up with all of these integrated and holistic healthcare places. And the first thing they're doing is putting you on a TRT regimen or a peptide regimen as the solving to the problem. That's not solving a problem. All you're doing is playing into the same pattern that you've played into since 1909, since it was bought by Rockefeller and given that out. And we're just simply following the same pattern we have for the last 100 years. It's no different than the opioid pandemic. It's no different than what we saw in our food pandemic. And now they're starting to do it in the proactive and preventative health space. Guys, I cannot be more bullish on this. We have to wake up. We have to realize that if you fail to take ownership and actually understand your body and actually start to take changes, that you are just falling into the same system that's going to make you sick, that's going to keep you sick, that's going to continue to keep having you spend money, because now somebody who gets on TRT, no longer a pharmaceutical, but somebody that gets on TRT at 28, 35, 42, you become a very valuable commodity because now you're going to be on that for life. So again, I go back to the question I asked, who becomes more beneficial to the pharmaceutical companies? Somebody who has to be on pharmas at 5 years old or somebody who has to be them on 75 years old? Of course, the person at 5 years old. So I'll ask the same question when we come into TRT and peptides, who becomes more valuable to you? Somebody who all of a sudden needs to be on peptides and hormones at 28, 35, and 40, or somebody who doesn't use them at all? Of course, somebody who gets on them earlier, because as soon as you get on them, what's happened is that you're going to be on them for life, because that's what you're ultimately leaning on to feel healthy, to feel good. Let inside, you're just decaying, you're just dying, because we haven't actually looked after the root cause of what's going on, which is why is your body not making testosterone and hormones appropriately in the first place. And so until we're ready to ask the questions and get deep and say, hey, I need some help to actually understand this, because I don't want to fall into the system. I don't want to fall into what the world's telling me. I don't want to fall into this traditional BS that's keeping me sick, that's keeping me disguised, that's keeping the wool pulled over my eyes, but rather I want something different. That is the moment that we are going to be able to take back the power. We are going to be able to take back ownership and move forward in a powerful way. And so when we come in, we start saying, okay, like Justin, what food should I eat? Where should I be getting my food from? Where should I be focused on? And I've talked about this a lot. And I've got this series coming out on how do we can ultimately take real ownership using these 5 different areas: in nutrition, in sleep, in exercise, in stress management, and then number 5, in habit behavior formation. I'm going to dive deep into all of those things in a single episode, 5-part series. I'm going to go over that. It's going to be something I'm really excited about. But when I actually take a step back and we start talking about our food sources, number 1, fruits and vegetables, we have to be buying organic. We have to be buying these things because the pesticides, the herbicides that are being sprayed are guys, the pesticides and herbicides that are sprayed, they have to spray them with hazmat suits. They spray a tasteless, odorless product that is a massive estrogen formulator on all of our fruits and vegetables. So we wonder why our world is getting more feminine. We wonder why our world is not producing testosterone. We wonder why we have a record number of people on having to go and use TRT simply because they want more energy. Well, we're not asking the right questions again. So we need to make sure that we're eating organic. We need to make sure that we're getting our fruits and vegetables in the organic section, or even better, going to the farmer's market. There's, I think, 11,000 farmers markets in America today. 11,000. And by going to these farmers markets, we can actually start getting the highest quality fruits and vegetables, getting the highest quality dairies. Dairy issues within humans is not the fact that that we can't digest lactose. It's in fact that what we're actually not able to digest is all the chemicals that they're putting in and the poor caged in cows and cattle that they're getting it from, and then all the different processing that it's going through. Then all of a sudden we start to look at, well, how do we get the best meats? Well, make sure that it's free range. Make sure it's grass-fed, grass-finished. Make sure that you're getting eggs from the farmer's market as well. Make sure that you're getting your fish from local sources. Like, make sure you're doing these things. And if we were just to do the bare bones minimum, when you go into a grocery store, go around the perimeter. Go around the perimeter. Literally just use it as a rectangle. Don't even step foot into the aisles. Because if you go around the perimeter, you've got your fruits and vegetables, which you can go organic. You've got your dairies, Try and go as simple as possible. Then you've got your meats. Make sure you're getting, again, grass-fed, grass-finished. Make sure you're getting some type of seafood that's wild caught. And then you've got your breads coming down the backside, and make sure, again, you're looking at the type of breads that you're getting. A sourdough, ideally, and a sourdough should simply be bread, flour, and yeast. That's it. That's it. Water, flour, and yeast, pardon me. Very simple, very easy. And anything else, leave it alone. This is going to have to be a paradigm shift in how you think, because what you're giving your kids and what you're giving yourselves is ultimately poison at the end of your fork. And if we don't ask better questions, we're simply buying into the lie that we've been told for so long. And ultimately, we become a part of the problem. And so I hope wherever you get this meets you where you are. This meets you where you are, and it makes you think, makes you ask better questions. Because here's the thing. I've been fired. I told you this before. I was fired from the NHL for asking questions, not getting in line and just saying, yep, this is what we're doing. I've never been somebody who just stands in line and is a yes person. I want to know why, and I want to understand why, when the results are not out there, why the results are not working, that we can't do something differently. And the same thing's happening here. And so I'm not just going to get in line. I'm not just going to say, hey, everything's good. Hey, we're moving in the right direction. Hey, this is where it's at. Because when you start to see the glaring lies, when you start to be able to put the dots together, when you start to be able to call out the things that are untrue, the truth is loud. The truth is loud. And I want the truth to be loud, because when the truth is loud, it might wake some people up. And so as I asked you at the very beginning of this, I want you to share this with at least 5 people. Because when you share this with 5 people, that's the only way it's going to get into those people's hands. Because I guarantee you, YouTube, not going to make any money off this one. YouTube, not going to reach anybody because they're going to suppress it. The podcast platforms and the marketing, it's all going to get suppressed because of things that I've said, because I talked about vaccines, because I talked about the food industry, because I talked about the lobbyist groups, because I talked about the marketing, because I talked about the different positions that people hold, because I'm calling out the lies. And so what happens is all of these different platforms, guess who they're funded by? Big Pharma and the food companies. And so the only way that this can reach other people is by you saying, hey, Mom, I want you to hear this. Sister, I want you to hear this. Brother, I want you to hear this. Friend, I want you to hear this. And sending this along. And so I really encourage you to throw this on social media, to throw this into your email newsletter, to throw this into your family chats. Get this in people's hands so that they can ultimately see, know, and understand this. And I encourage you to challenge me. Challenge me. Go and type in any of the questions that I just typed in. Hey, how many of the major food companies are on lobbyist groups or on government panels? Hey, how many people in the TRT industry are owned by pharma companies? How much of the TRT and peptide industries are owned by big pharma and processed food companies? You'll start to see that all of this is working together. You'll start to see the things that are happening behind closed doors. And when you open up what's behind closed doors, when you shine light on darkness, darkness can no longer exist. And that is what we're trying to do here. This is a spiritual play. This is something so much bigger than you and I. This is something that has a lot to do with how well human history will continue to evolve and change, or whether we are on the road to our own demise. This is what we have to do in order to start seeing things differently. And so again, I encourage you to please share this, to please empower other people, to please speak into other people so that we can take ownership of our health and start to realize a life that is different. Success is different. So own your different. And we'll see you guys next week.